You read the title correctly. I'm about to show you how to get a GPR level experience while you're still in dental school, which will basically save you a year of your life and set you up to get out there, practice, and start making money as soon as you get out of dental school. So first and foremost, there's nothing wrong with doing a GPR, but to believe that doing a GPR is going to set you up to have success in the dental field isn't 100% accurate, I believe. Some of you guys, you go to dental schools, which your requirements are essentially nothing, and that's why you should do a GPR. I myself did one. I actually left it early though. I could talk to you guys about that later, but you can get this GPR level experience while you're still in dental school. And I'm gonna break down exactly in this video how you can do that. So let's just first talk about these two overarching areas of skills, right, that you need to have success in dentistry. You have clinical skills, and then you have, let's call them soft skills, which is your ability to lead, your understanding of business, understanding operations, knowing how to communicate effectively to not just your patients, but to your team members, to your staff, to get them to do things, your ability to influence, right? So a GPR is not gonna touch that at all. Dental school is not going to touch those skills at all. It will help you clinically, right? We all need to go to dental school to get the skills to get our license. And in a GPR, you may get more intense level of clinical training. You're definitely going to see more patients, but is it going to set you up for success? Depends, right? Do I think it's needed? No, not if you follow my channel, really, and listen to all the things I talk about in here. But let's talk about why people think a GPR is necessary in the first place. Dentistry, or in the business of dentistry. The academic system that exists in dentistry push it because they don't necessarily know how to prepare you for success in the modern field of dentistry or in the business of dentistry. And their thinking is, oh, just get more practice somewhere else and they'll set you up. But what they're missing is that GPRs aren't necessarily designed to understand the real world practice. Yeah, you may have some attendings who are great and they let you in and they inform you about the business side and, kind of give you some more specialized mentorship, but don't expect this. Now, what I help students that I work with do is get what a GPR gives you, which is exposure to specialty, more patients, right? More training in things like endodontics and extractions. And I call it the stealth residency strategy, right? This is how it works. So phase one is to finish all of your requirements months in advance. So what we basically do is design a strategy for that student based on their existing patients and the procedures that they need to complete. We create a roadmap to get their procedures done pretty much in 50% of the time that it would be taking the average student. Phase two is real world education. With requirements done early, we can go over things like treatment presentation, treatment planning, go in more depth in procedures. They can assist the postdocs that are in prosthodontics, that are endodontics, and basically get chair-side experience and be walked through these procedures with an attending there. So you're getting a little bit of exposure to all the post-grad programs. And phase three is the launch, right? Once they graduate, setting them up for job interviews, setting them up to understand contracts, setting them up to understand metrics and a DSO versus private practice and what to look for and how to grow a practice and how to hit the milestone of producing 100 plus a month, 100,000 plus a month in gross revenue, which I think is the ultimate milestone to basically solidify yourself as someone who can go into private practice, who can lead as an associate. So the students who've executed this strategy successfully and follow the same blueprint, you're gonna understand why it's a lot more effective than per se going to a GPR. And there's nothing against GPRs, guys. I don't want to talk down on it. I think it's really good for some of you. You can message me and your situation, and if you want my advice, I can try to help out. But this blueprint that I'm talking about and I work with students is one, the requirement acceleration system, which I just talked about, getting them to finish the requirements early and then basically maximizing the free time that they've just acquired to being better clinicians, understanding procedures more, getting exposure to different specialties, doing more procedures, right? Seeing more patients, being able to go into the endo clinic in your school and shadowing them and getting permission to do molar endo, right? Because you've already done all your requirements and you're going to keep seeing patients, right? So because you've done the requirements in such a small amount of time, you now have more time to see more patients. So, which gives you more comfortability in what you're doing. Next component is understanding the business and the treatment planning and treatment acceptance component of it. So the students I work with, they're not just trying to get the requirements done. They are practicing in real time how to present treatment, how to effectively communicate. We do role playing, and they're basically practicing on their patients, the things that we discuss, so that when they do go out into the real world practice, they're already comfortable. They have their chairside manner mastered, right? Patients love them, patients trust them, patients want to, encourage them and support them. So I'm basically going to talk more about this in my masterclass webinar. You guys can just basically hit the link in my bio. It's completely free. Just join the event. I'll show you exactly how to execute this, what that looks like in more detail. You guys will be able to ask me any questions you have about it. And spoiler alert, I'm not selling anything. The only thing I do offer is for those that are really serious, they could schedule and book time for us to work one-on-one, go through their case and strategize, how to set themselves up for success. And because it is so early, I basically charge a fraction of what I actually make doing dentistry. So this is really just because I feel like this doesn't exist, and I wish I had this when I graduated. I went through a lot of growing pains, but because I was so steadfast on learning and trying to get better, I figured it out myself somehow. But yeah, so I hope I see you guys there, and especially seeing other dentists with channels on here and they are only making like 19% collections, and I just feel like they're misguiding a lot of you guys. So yeah, I think that I can provide you guys with some value. So I hope to see you guys there. I'm always looking from afar and rooting for you, and I wish you guys the best. Peace.